How can you tell?
Good afternoon, everybody. Thank you so much for joining us. My name is Darian. I'm the Marketing and Development Director at the Lighthouse of Houston. We've got a really special online webinar today. But real quick, I'm going to tell you just a little bit about the Lighthouse of Houston. So for more than 85 years, the Lighthouse of Houston has been supporting individuals who are blind or low vision through our health services, assistive technology resources, community and support programs, vocational skills training, and internal employment opportunities. We foster communities of belonging with accessible resources that enable personal and family well-being, learning, development, and employment. And of those we employ, 60% are blind or low vision. Our goal with these online webinars is to just connect the community with helpful resources and share about interesting other organizations out in the community that may be of help to you all. So I'm super excited to have Taya Compton here today. And she's going to be talking about Texans Recovering Together. So go ahead and help me welcome Taya.
Good morning. Again, so my name is Taya Compton. If it's hard to remember, just think Taya Shoes. And Texas Recovering Together is an entity that was sponsored by FEMA. After Hurricane Beryl hit in July, they said, hey, we're going to put the money out into Harris County to try to help everyone recover, but we also want to get some good programs into the community. So we are partnered through the Harris Center for Mental Health and IDD, and we will talk about that as well. So to get started here. So a little bit about our services. We offer crisis counseling, support groups, and public education. Our crisis counselings are for individuals. You do not have to be in crisis. What it looks like is you'll have a crisis counselor contact you. They'll work with you to try to get some resources to you if you still are affected by the hurricane. Some people, surprisingly, still have trees in their fences, or people have paid money out of pocket and now they've completely depleted their savings funds, or they're not sure how to get FEMA to reimburse those funds. So we go in, we try to help. If you've already applied and got denied, we try to help with the appeal process. If you have not applied, we try to help people go in and see what they're able to still get refunded. Again, the services don't have to be in crisis. If you'd like to just get your feet wet in counseling, we offer 5 free sessions. If needed more, we can extend those out. These are tailored to the individual. So if you prefer to have your sessions on site, we can. If you prefer to have your sessions virtual, we also do that as well. Our support groups look a little different. They're usually tailored to the community, so it depends on the topic that feels relevant to the group. So we can have support groups for individuals of a specific population. So for those who are blind or visually impaired, we could do topics, that are related. We usually try to survey the group and decide what topics are relevant and necessary. We can tailor the support groups for families, or they can be groups of entities. So staff members, our community members as well. So we have ran support groups for stress and management and burnout for staff. Our public education is usually centered a little bit more around disaster recovery, but again, those topics can be tailored to the group that we're speaking to. So we will provide outreach opportunities. If there's events going on, we love to come out, table, provide those crisis counselors on the scene for people who want to talk about anything. We do presentations such as this today, specifically about our services or about how to prepare for disasters before they come, how to prep your homes for disasters before they approach, or how to deal with the aftermath of disasters. We also offer workshops. These are a little bit more tailored to staff members, but also the same topics, how to prepare, deal with disaster. But we also try to prepare staff members and entities for dealing with the community, how to get resources to community, how to work with community, and definitely how to support the community when there are disasters approaching. I think recently we've had the snow and the ice. Gratefully, it has not affected anyone like it did in 2021, but definitely if you are still having some issues or you're still being affected by Hurricane Beryl, we are open to the public. So again, I've listed our QR code. This is how you would get in touch with us. Our services are free. Again, the services are free, $0.99. All you have to do is scan the QR code. There'll be a list of 9 questions. It's completely anonymous. So it'll say, have you been affected by a storm? Even if you haven't, you can click Hurricane Barrel, and then the counsel's your method of contact, and it'll either be a phone number or email. I do try to warn people, if you're using an email, then to try to monitor it, because they reach out within 24 hours or 48 hours. And yes, if you work with a specific counselor at an event and you want to continue working with that counselor, it has a space where you can designate that name. And then we also offer Spanish speaking as well for those who need additional services. So again, we are partnered with the Harris Center for Mental Health and IDD. So what this looks like is our grant ends in July. So our services are free until July. But if you are enjoying the services, you feel like you're being able to get your needs met, but you want to continue, we are referring people back to the Harris Center. So the Harris Center has children's outpatient mental health services, they have IDD mental services, and they have adult services. So for our children, you can walk in from 7:30 to 7:30 a.m. to 3 p.m., and you can request an intake appointment, or you can call 713-970-7000 and hit option 2, and they will connect you with someone to try to get you scheduled in and get services started. Our services are on a sliding scale, so it is income-based for the Harris Center. Again, Texas Recovering is free to the community. Our adult services have 4 main locations: Northwest, Northeast, Southwest, and Southeast, but we do have smaller entities as well. So what's going to happen is when you call that 7000 number, you hit option 2, they schedule you with someone to get the intake process started, and they will actually choose the clinic that is closest to your home. And they will also get you started with financial services so that you'll know how much is expected of you. Usually it's free to the community, but if there is a cost, they'll let you know before you go into the services. This is for psychiatric care, case management. They offer counseling as well, housing support. Primary care is new. We've started an integrated health program to where people can get primary care services as well. So it should be like a one-stop shop for all. And now we'll open the floor for any questions.
All right, everybody. You can join me on screen if you'd like. So we're actually here together today. A little bit different for y'all at home, but thank you so much for sharing. And so when it comes to the different disaster relief services, what can people expect if they need support, or what can they reach out to you guys for?
So I think the most common thing has been a lot of people were approved for the $750 that FEMA was offering for food replacement. Well, those have since closed, but there are a lot of services that are still open. So we are mostly getting a lot of people who need help with reimbursement if they were out of pocket, or getting accessibility changes to their homes for disasters to come. And so people who applied but were denied, we're helping appeal. And if they want to apply and get those changes to their homes made beforehand, because it's Harris County, we experience a lot of tropical storms, we experience a lot of floods, things like that. So trying to get those things ready, so that we don't have to prepare, deal with the aftermath before, if you prepare ahead of time. So.
Of course, yeah. And so that's kind of the disaster relief side of things. And the Harris Health side of things is more where people can come and get the mental health support.
Yes. So I've worked for the Harris Center for 5 years now. I love it. I'm a firm advocate. I've done the therapy. I've done the case management. We offer criminal justice involved people. I think that the only thing I am not 100% sure of is geriatric care. I think we outsource for geriatric primary care, but I think we still provide geriatric psychiatric care, so mental health. Yes.
Awesome. So it seems like you definitely serve people of all different ages. Is there any requirements that people need before reaching out to you guys?
No requirements. I know some people are a little concerned about if they are legally documented citizens. As of now, that is not something that will affect you getting services or not. Not with Texas Recovering Together. I'm pretty sure not as well with the Harris Center. But as of now, as long as you know your financial standing, your personal information, you should be able to get started. Services, we try to get people in and seen at least within a 2-week time frame after they're initially assessed.
Okay. And do the assessments start on the phone, or how does the process what does that look like a little bit?
So your initial assessment can be on phone, and it'll be with the clinician, and they'll try to get a lot of your background history, your symptoms, and how they're related to one another. And then they'll get you scheduled, hopefully within the 7 days, with a doctor. And so then the doctor will go in and they will talk about the symptoms that were listed, and they'll kind of take into account your background history, and the doctor will try to focus on treating the symptoms and then getting you referred for all of the needs that were listed based on your background history. So if you say, hey, I need housing, I don't have health insurance, I want to see a counselor for therapy, then the doctor will put in all the referrals. You'll get assigned to a case manager and assigned to a therapist. And then hopefully everyone just kind of takes a piece of the puzzle, and we all try to work interconnectedly to get all of the needs met.
Wonderful. All right. Does anybody at home have any questions? We'll probably be wrapping up our little presentation here in just a couple minutes. All right. And so when it comes to maybe our population who are blind or low vision, would they be able to find support for those types of mental health concerns?
So yes, the mental health concerns will definitely be addressed. As far as housing, I know we do have specific housing for mental health. There's specific housing for IDD, and then there are specific housing for I can't think of the category they put it under. My mind is saying ADA, but there are 3 subcategories, and they try to provide you housing that is appropriate for your needs. And so those who would go to the mental health housing would have I call them boots on the ground. We have the caseworkers and therapists who are there daily throughout the day, helping with medication, things like that. Those who are IDD, of course, they have home health aides. They have those kind of technicians that also come during the day as well. And so I'm assuming, I hate that I cannot remember the category, but they would have the same accessibility and support in that housing as well. So.
And would the best way to get in touch with you guys be that 7,000 number?
So the best way to get in touch with us for crisis counseling would be the QR code. If you are interested in all of the additional services, would be the 7,000 number.
And just for everybody at home, I put the QR code back up on the screen. So if you're looking for crisis counseling related to Hurricane Beryl, feel free to scan that right now. And you did say that the Hurricane Beryl services are free for the time being?
Yes, ma'am. And then if it's because it's a lot of lines to go through. Some people find it difficult to go through the phone line system. If you scan the QR code, our crisis counselors would definitely be able to help you get connected with the Harris Center and get those services started. We try to make it as accessible and just easy as possible, because we know everyone is not tech savvy. I'm not tech savvy. So.
Awesome. We definitely love a good QR code around here at the Lighthouse. So, all right, everybody. Well, I think that's going to bring us to the end of our presentation today. We really appreciate Taya coming out today and sharing these awesome services with us. If you want to rewatch this presentation, it'll be available on YouTube and Facebook. And definitely reach out if you guys are in need of some mental health support or hurricane recovery support. All right, everybody. Well, we hope to see you at next month's online workshop. And the Texans Recovering Together will actually be at our health fair in April. So if you want to learn a little bit more about them, you guys can definitely come out to that and meet them in person. And until next time, we hope you all have a wonderful day. Thank you all so much for tuning in, and we'll see you next time. Bye, everybody.